The HIV outbreak we've been telling you about in Penobscot County is growing. The Maine CDC says 27 people have now been diagnosed with the disease since October of 2023. A nonprofit in Bangor that is working to help people affected by the outbreak is struggling to expand its services due to a zoning violation now in the building that they were hoping to call home. News Center Maine's Christian Harsa has more.
Thank you all for coming today. This is in relation to the temporary closure of our new location.
Needlepoint Sanctuary of Maine Executive Director Will Hurley says the nonprofit planned to operate out of this building on Ohio Street in Bangor. It did so starting July 3rd before receiving notice just 5 days later that it was in violation of city zoning regulations.
This really came as a surprise to us, right?
City of Bangor Communications Director David Warren says multiple city agencies have talked with Needlepoint Sanctuary about a new location.
But there was never any discussion specifically about that Ohio Street location.
That area is zoned as a neighborhood service district.
The zoning in that part of Bangor just does not allow for the services that Needlepoint provides. And so that's really the issue at hand.
Needlepoint Sanctuary offers food, free disease testing, and drug resources, and it currently operates 2 days a week out of rented church space. Anthony Miles attends weekly and says it's a safe haven.
We come here, we enjoy a good meal, good laugh, and hang out.
The new space would have given Needlepoint Sanctuary a physical space of its own to run its needle exchange program. Wabanaki Public Health and Wellness is the only other state-certified syringe exchange provider in the city.
There is far too much work for any one syringe exchange or harm reduction program to do.
Co-CEO of Wabanaki Public Health, Lisa Sakabason, says Needlepoint Sanctuary has strong connections in Bangor's homeless population.
So the work that Needlepoint Sanctuary does is critical.
Warren says the city of Bangor appreciates the work that groups like Wabanaki Public Health and Needlepoint are doing.
I mean, this is a critical issue that's arisen.
Those experiencing the crisis say the situation is dire.
This community is in desperate need of, syringes and stuff like that.
And want to see Needlepoint Sanctuary in a more permanent space.
We are really excited that we are going to be moving out of a basement, out of the shadows, and finally out and open to the community, and say, hey, here we are. This is what we could do for you.
The city of Bangor and Needlepoint Sanctuary both say they are working together to find a solution that meets the demands and requirements of both city and nonprofit. In Bangor, Christian Harsa, News Center Maine.